Good afternoon, everyone. Welcome to our webinar, Balancing Healing, Weighing the Pros and Cons of Alternative and Traditional Medicine. My name is Tony Brantley, and I'm a program coordinator with the Community Health and Wellness Team here at Suburban Hospital located in Bethesda, Maryland. We're thrilled to have you with us today for this important discussion. Throughout the presentation, we encourage you to submit any questions for our guest speaker using the Q&A box at the bottom of your screen. At the conclusion of the webinar, a short evaluation will appear. We will greatly appreciate your honest feedback as it helps us improve future programming. Please note that today's webinar is being recorded, and a link to the recording will be shared in the coming days. Again, thank you all for being here. It is now my pleasure and honor to introduce our guest speaker, Dr. Janet Siddiqui. Dr. Janet Siddiqui is a respected healthcare leader, administrator, and educator with a strong foundation in both conventional and integrative medicine. She has been affiliated with Johns Hopkins since completing her residency at Georgetown University and earned her MBA from the Johns Hopkins Carey Business School. Dr. Siddiqui currently serves as the Office Medical Director for the Johns Hopkins Community Physicians Practice in Odenton, Maryland. In addition to her clinical role, Dr. Siddiqui is the co-director of the Integrative Medicine course curriculum at the Johns Hopkins School of Medicine, where she teaches first-year medical students. She also lectures on integrative medicine for nurse practitioner students at the Johns Hopkins School of Nursing. A diplomat of the American Board of Integrative and Holistic Medicine, Dr. Siddiqui integrates evidence-based complementary approaches with conventional care to support whole person health and wellness. Outside of her professional work, Dr. Siddiqui enjoys gardening, spending time in nature, traveling, and being with her family. Without further ado, I'm honored to present Dr. Janet Siddiqui.
Oh, thank you, Tony, so much. And it's such a pleasure to be here with all of you. And so we got a lot to cover, so I'm just going to get started. I don't have any financial disclosures. And the most important thing is, always discuss any changes in your lifestyle plan with your doctor. So some of the things we're going to cover today, I'm going to give you a little bit of a history on the background of integrative medicine. We're going to talk about some common supplements and herbs, some mind-body therapies. We'll talk about some evidence-based diets and how they relate to food as medicine and what is culinary medicine. I'm going to talk about some of the traditional medicine systems and give you some helpful hints maybe for some chronic disease management. So what is integrative medicine? So there's an academics consortium that is across the country, and it involves many universities and medical schools. Johns Hopkins is involved with this. Also Yale, Harvard, Stanford, prestigious schools across the country. And so their definition of integrative medicine includes the importance of the relationship that you have with your practitioner, focuses on the whole person, and we'll hear this term throughout the presentation about the whole person, and then also using all appropriate therapeutic lifestyle approaches, healthcare professionals, and all disciplines to achieve your optimal health and healing. And I like to think of integrative medicine as sort of overlapping, all that's important in our life. Conventional medicine, what we know when we go to our doctor and the treatments that we get, if I'm having a heart attack, I want to be at, Johns Hopkins Hospital and getting the best sort of treatment. I don't want to be taking a herb or a supplement at that time. But lifestyle medicine, we're going to hear, is very important in what you're doing on a daily basis for prevention and longevity in your life. And then complementing that with some of the evidence-based integrative therapies to sort of manage your health and your diseases. And whole person health, we're very good. We're good. We know all about the body and how to treat that in conventional medicine, and we know a lot about how our brains work and our mind. But combining all those and looking at your spirit, and when I talk about spirit, I talk about, what's in your soul, what gets you up in the morning, what drives you, what are your emotions, and how you deal that with those during your lifetime. These are a bunch of terms that have been over the years, previously we'll talk about this, the CAM was complementary and alternative medicine. The names have changed over the years. There's also functional medicine. Lifestyle medicine is very popular these days. And then the new term is actually whole person health. So many of the therapies that we're going to talk about today have been around for thousands of years. Around 1900, Flexner was charged by Carnegie Foundation to look at all the different medical schools and come up with more streamlined conventional therapy. And actually, Johns Hopkins became the uh, school that was the main school that was going to proceed throughout the years in terms of research-based conventional therapy. So it was really the model school, and that was wonderful. Yet because of that report that he did, there was a lot of medical schools and different types of naturopathy schools that closed, and this caused some inequities to access of healthcare and therapy. So if you ever get a time to read the report, it's very interesting. Then over time, after World War II, people started dabbling again in terms of alternative therapies. And then CAM, the complementary and alternative medicine, became sort of an umbrella term after that. So one of the things we're going to talk about more when we talk about chronic disease is the importance of diet. And there's been terms out there, food is medicine, and now there's culinary medicine. Culinary medicine is actually blending the art of food and cooking with the science of medicine and how food can be incorporated to help control disease processes. And it really makes you responsible for your own decisions in terms and make sure that you're eating high quality meals that will help not only prevent disease, but also sometimes treat disease and restore well-being. Baltimore City has a program that they're doing at Harbor Hospital and for diabetics, and they taught them how to, sometimes you hear it, this is what I'm supposed to eat, but really teaching them how to cook and how to use different foods for their diet, and their hemoglobin A1Cs in these diabetics has dropped significantly. So that's a really great example of how food is medicine. So we're going to talk about a few of these evidence-based diets. So the DASH diet stands for Dietary Approaches to Stop Hypertension. You may have heard this before. The focus of this diet is mostly the low sodium, even trying to keep it under 1,500 milligrams to have the greatest effect. But it's also avoiding sugary beverages. It's low fat, lean protein, lots of fruits and vegetables, and nuts and legumes. And it definitely has shown over the years to help reduce high blood pressure. Mediterranean diet is also well studied and very popular these days. Again, lots of whole grains, fruits, vegetables, limiting red meat, quality dairy. One of the most important components of this diet, I think, though, is it incorporates physical activity. And that doesn't necessarily mean, you have to be on a high intense exercise program. Sometimes it's just walking. And then also making mealtime social, getting together with family and friends when you eat your meals. And then the research on the Mediterranean diets lowers the risk of death from cardiovascular disease and stroke, cancer, Alzheimer's disease, Parkinson's, and type 2 diabetes. And just some other things that it's shown a reduction in: frailty, childhood asthma, sexual dysfunction in men and women, arthritis. So lots of good things from the Mediterranean diet. Now, the MIND diet, which is a combination of the Mediterranean, the DASH diet, was looked at for neurodegenerative delay. And so the combination in a study in 2015 with Rush University showed improvement in cognitive function and slowed the decline of Alzheimer's. Key components of this diet was they eliminated the dairy, red meat, and tried to eliminate sweets, fast foods and fried foods. Very popular these days, and a lot of research behind it, is the whole food plant-based diet. So Michael Pollan said, eat food, not too much, mostly plants. So trying to eat plant-based foods in their whole unprocessed forms. You know, lots of veggies, fruits, whole grains, nuts, seeds, and trying to transition away from eating fewer animal products and dairy, processed foods, and sweets. That's probably one of the most important things that we can do, is like really getting away from processed foods. It shows that it lowers cholesterol, blood pressure, blood sugar, reduces the risk of heart disease, lessens inflammation in the body, and a lot of people support that it reduces animal product consumption. So I threw this slide in. Talking about the microbiome is a whole lecture in and of itself. On the left-hand side, you have all the plants. On the right-hand side, you have the fried foods, processed foods. Your gut and the whole gut-brain connection is so important. And by eating, healthy foods, lots of fruits and vegetables, you have the good microbiome that decreases your blood sugar, increases energy production, helps your immune system. By eating a lot of processed foods, you get the sort of bad bacteria in your gut, and that can lead to autoimmune problems, increase your blood sugar, and metabolic disease. So always want to be focusing on fruits and vegetables in your diet. So now we're going to talk about supplements and herbs. It's a huge industry, over $40 billion, over 100,000 supplements on the market. It makes up about 20% of integrative therapies, and about up to 80% of people are using herbs and botanicals. It's so important that you tell your doctor about what you're using. Because, a lot of times you go into the office and they'll say, oh, what medicines are you on? And you'll give them your list of medicines, but a lot of times nobody asks, like, are you taking any vitamins? Are you taking any supplements? Are you taking any herbs? So, always, discuss with your doctor about what you're taking, so they can make sure that, that there's no problem or interaction with other medications or drugs. So in 1994, Congress came up with the Dietary Supplement Health Education Act. And so basically what happened at that point was that any new products coming up that were considered, supplements or herbs, had to submit notification to the FDA. And, while a lot of people would like to see more oversight from the FDA, there is a certain amount of safety and quality burden that lies with the FDA, and they set standards for purities, strength, potency on labels. Always look, if you're buying a product, always look for that little symbol down there in the right-hand corner, the CGMP. That means that the FDA has audited their facilities, manufacturing facilities, and for quality and meeting the standards. If that label's not on there, it doesn't mean that it's not okay to use. I mean, it's it may be okay. It's just they haven't been evaluated by the FDA. Oops. There we go. All right, so these are some common evidence-based herbs and supplements. Some of them you might be taking already. Some of you may have seen some of your, other friends or family or patients using. So fish oil, very popular. It's used for, blood pressure, heart disease, lipid management. It can help improve rheumatoid arthritis. Ideally, we'd like to get it from, fatty fish and nuts and flaxseed and things like that. But if that's not in your diet, then you might want to consider a supplement and always, discuss with your doctor. Glucosamine chondroitin. The research is a little bit mixed here for considering it for like arthritis or joint problems. But I think it's probably safe to consider, just trying to see if it helps at all. Probiotics, again, very popular for your microbiome. Research does show that it can help, after you've been on antibiotics for an infection, to help get things back to normal in your digestive system. Also commonly used during the winter time to help prevent colds and flus, because it does, as I mentioned earlier, your gut is important for your immune system. And then also sometimes for eczema and irritable bowel disease. Melatonin, a lot of people use it for sleep, and also for it's safe to use in short term. I wouldn't consider it, using it every night. But safe to use in short term. CoQ10 is used in some heart failure and heart conditions. People use it for migraines. And it's also used sometimes in Parkinsonism. Vitamin D, you need vitamin D to absorb calcium. So it's if you're not getting in your diet, we all don't get enough sun these days. Can slow osteoporosis. It's important in the elderly, and concern about risk of fractures and things like that. And then magnesium used in migraine, sleep, and constipation. Some other herbs we're going to talk about is echinacea. Studies are here. Most of these here, the studies are mixed. So echinacea has been shown to be sometimes effective for colds and flus and may shorten the course. Black cohosh, mixed studies, but can help with menopausal symptoms. Saw palmetto, mixed studies again, but can help with benign prostate hypertrophy, and it's safe to try and see if it helps. Garlic is an antioxidant, and if you have any heart condition, you probably should be on garlic. And then ginkgo, mixed studies for dementia and Alzheimer's, and then turmeric, curcumin can help in reduce inflammation and arthritis and decrease your cholesterol. And then ginseng, safe for short periods. It's used a lot in the Asian culture. Probably more research is needed, but helps a lot with performance. St. John's wort, you'll see that on the shelves, and used for anxiety and depression. We'll talk more about that in a minute. Flaxseed helps with inflammation. High fiber, good for cholesterol. And then valerian helps with sleep, helps with more of the staying asleep, and you can find it commonly in teas, some teas. And then ginger, used for nausea, vomiting. And when we talk about these herbs and supplements, it's just like medicines. Like you have to respect herbs as much as you do conventional medicines. And a lot of our conventional medicines have come from herbs, like digoxin came from, I'm blanking now. Anyway, so a lot of them foxglove. So a lot of our medicines have come from herbs, and you have to respect them just as you do your own medicine. So like not necessarily taking more of an herb is necessarily going to be helpful. So supplements to avoid, kava. Kava can be associated with liver disease and hepatitis. Ephedra was banned in 2004 by the FDA. There was a Minnesota Vikings football player and a Baltimore Orioles pitcher that died after using ephedra. Bitter orange or yohimbe can increase heart rate and blood pressure. And then St. John's wort is banned at Johns Hopkins because it can interfere with blood thinners. So now we're going to move on to mind-body medicine, and these are a few that we're going to talk about. So Reiki is an energy-guided self-healing practice, originated in Japan, can help with relaxation, anxiety, pain, depression. There's a hospital-based programs at Harvard and Yale, and in a study in 2010, patients that after they had a myocardial infarction or a heart attack, it improved their heart rate variability and emotions. Massage therapy, used for thousands of years. It's the largest group of integrative practitioners in the United States. They have to be certified and can help relieve pain and stress and improve overall well-being. Many types of different massages. This is just a few. You know, if you go to a spa, you'll see so many choices. It's very confusing, but these are a few of the ones that have been looked at and researched. So helpful with chronic pain, cancer pain, can manage stress, lower blood pressure, improve sleep, help with your mental health, help with stability, arthritis pain, even some research in terms of helping fibromyalgia and HIV and AIDS. Meditation, very popular these days, and there's so many meditation apps that are out there. It's a practice of focusing and clearing your mind. You know, it can be mental, physical techniques, it can have combined breathing, and it just improves your overall brain health and well-being. It's about clearing your mind, focusing, and giving your brain sort of this deep relaxation. Again, many different types of meditations. You know, think about it as you know, ice cream. There's lots of different flavors, and you just have to find the right one that you like. So mindfulness meditation. There's movement meditations that include the yoga, qigong, walking, gardening. Mantra meditations, which is similar to transcendental meditation. Transcendental meditation is usually taught by a practitioner. There's progressive relaxation body scan where you go through each part of your body and sort of work on it to relax. Loving kindness meditations, and then guided imagery and visualization meditations. Oh, I don't know how I got those slides in there. All right, so great improvements and research in terms of meditation effects. And this one is in particular shows the increase in gray matter, so that may or slow or stall and reverse the normal aging related changes, and can impact learning and memory, and change emotions. So this was a great study that showed that. It's been shown to help with anxiety and depression, reduce blood pressure, insomnia, help with irritable bowel, and overall reduce healthcare costs. Qigong is sort of a movement meditation. It's part of traditional Chinese medicine, and it optimizes energy within the mind, body, and spirit. And the goal is improving health and well-being. Some of the Qigong studies have shown that it helps patients with fibromyalgia, COPD, Parkinson's, hypertension, and chronic heart failure. Tai Chi is also a movement meditation. It's similar to Qigong. It's a series of slow, gentle movements and postures. Originally was a martial art in China and helps reduce falls in the elderly, osteoporosis, Parkinson's, heart failure, and COPD. One of the things when you do start any of these sort of programs, especially if you're over 65, have any, problems with falls, injuries, or trouble with your spine, make sure you discuss with your doctor that it's okay to perform these types of movement meditations. One of the interesting things about Tai Chi, Harvard is doing a lot of studies for patients with COPD, and it actually improved their exercise capacity, shortness of breath, improved their overall activity, and just made them feel good about themselves. Guided imagery, hypnosis, biofeedback. You've probably heard the term mesmerize. It was hypnosis was started by Dr. Mesmer, and it's a deep relaxation used while making suggestions for perception, memory, or to alter an experience. Has been used for pain management, for anxiety, nausea during chemo for cancer patients, and even children can be taught self-hypnosis. A lot of people use aromatherapy and essential oils. And, a lot of people use lavender for sleep. I usually, some aromatherapy people that use aromatherapy on a regular basis or know a lot about aromatherapy, they may talk about using certain ones as ingesting, but I usually just recommend topical or the diffusers can help with pain, nausea, vomiting, anxiety. Now we're going to talk about some home medical systems. And these are some examples, and I'm going to talk about a few of these. So Ayurveda, India's one of the world's oldest medical systems, originated in India thousands of years ago. The main focus of Ayurveda is the diet, and depending on what your dosha is or what type of person you are, you have a different diet. They also use a lot of different herbs for treatment of disease and oils. Homeopathy came to the US in the 1800s. It came from Germany. FDA requires homeopathic medicines to meet certain legal standards, similar to what we were talking about earlier. And yeah, so it's just a disruption. They say it's a disruption of the vital force. You may have heard of like cures like, so giving a small dose of something that might trigger an illness is to help with the cure. So it's usually one medicine. It's a series of dilutions, trying to use the lowest dose possible. Naturopathy is a medical system that's sort of came about a combination of healthcare practices in Europe during the 19th century. Naturopathy, they have to be trained and have a 4-year advanced degree. They are licensed in 23 states, including Maryland and DC. But they focus on a lot of similar things: nutrition, stress reduction, lifestyle modifications, counseling, using herbs and supplements, and some homeopathic remedies. Chiropractic medicine focuses on the relationship between the spine and the nervous system and the structure of the spine. It's been used for centuries, but came to the United States in the late 1800s. Oh, there's over 65,000 practitioners. They do go through rigorous training of 4 to 6 years and have national and state licensing exams. It's recognized in all 50 states, and millions of people seek care every year. Most insurances cover it, and it is available for military and veterans. Very common back pain is treated, can also help with asthma, ear infections, carpal tunnel. It's usually a high velocity, low amplitude thrust. And depending on what's going on in specific areas of your spine, they'll also use heat and massage. It's important, as you get older, if you have any degenerative changes in your spine, that you discuss with your doctor about whether chiropractic care is important for it, will work for you. Traditional Chinese medicine, thousands of years old. Again, one of our oldest traditional practices. They use herbal medicine and also acupuncture, the Tai Chi and the Qigong to help treat and prevent disease. So it's based on the premise that we're subject to all the same laws of nature. Disease is either a form of deficiency or excess, and then using acupuncture or herbs to help restore balance. And I love this slide. This is early acupuncture. So yeah, millions of people using it every year. 1 in 10 adults have tried it. Again, common reasons is the pain or addiction, neurological disorders, and 50% of people are usually satisfied. So so it's about the flow of energy and rebalancing that flow, and the needles are placed in different places along your body called meridians. And you think of it as meridians as like rivers and flows of energy. And again, it's just one component of a larger treatment program, and definitely can help with many different conditions. It usually takes about 20 minutes. The needles don't really hurt. Some people just say it's more of a pressure feeling. And it affects the opioid receptors, so can be, used for chronic pain conditions, and also some related to some degenerative spinal disease. If you're having numbness or pain in your extremities, it can be helpful. And these are just all the different meridians. So now we're going to highlight a few chronic conditions: cancer, dementia, and heart disease. So with cancer, so in integrative oncology, so it's a combination. You can also, at Johns Hopkins, at least at the main hospital, in the cancer center, they do have an acupuncturist, so they're using acupuncture. Other things that can be a benefit is massage and mind-body therapy. Nutrition, definitely anti-inflammatory diet while you have cancer, IV vitamin C, herbal support, but of course with your oncologist guidance based on your treatment plan. Emotional support, so important. There was a study years ago where they had two groups. One was had patients, women that had breast cancer. One was in a support group and the other one didn't have a support group. And what they were looking for is just a decrease in depression, and anxiety related to their breast cancer. But what they found out is that the patients that had the support group lived longer. So having support, while you're going through cancer treatments is very important. Uh, and then, other types of therapies that help with just fatigue, yoga, music therapy. We didn't talk about much, but that's really important too. And then just sometimes therapeutic touch. Dementia on everybody's minds these days. So some mind body therapies that help. We talked about some of those earlier. Music therapy, art therapy, guided imagery to help support memory and mood, nutrition. So let's talk about this nutrition a minute. While the mind diet has been studied, there's more research that just came out in the past year in 2024. University of California, Dr. Ornish, who did a study where so the key components here are social, physical, nutrition, and stress reduction. So they studied a group of people that had dementia symptoms and some with dementia, and they did a whole foods plant-based diet. They did different therapies for stress reduction, some of the mind-body therapies that we talked about, physical activity, and then the social component as well. And there was, over 40% had reduced symptoms, and also, it was, and then another like 30 some percent were helped as well. So it's just amazing, how important those components are. And a lot of different programs talk about, nutrition and exercise, and an exercise doesn't have to be, like you're running a marathon, but even just, just walking or doing some of the movement meditations that we talked about, like Tai Chi, are important. So all those important for prevention and treatment of Alzheimer's. Heart health. Actually, Dean Ornish also did in the 90s the same sort of program, but with nutrition, stress reduction, movement, and diet and everything. So either whole food plant-based diet or Mediterranean diet, doing the omega-3s, CoQ10, the stress reduction, the movement, and then sleep and sleep. Yeah, we didn't talk much about sleep. Sleep is really, really important. So as much sleep as you can get is helpful for the body to repair and restore itself. So what are the cons of integrative medicine? So one of the big challenges, a lack of extensive research, and it's definitely improved over the years. We have a lot more research than we used to. While there's a National Center for Complementary and Integrative Health at NIH, we've gotten more funding over the years, but still it's a small drop in the bucket as compared to the overall NIH funding. So, but there's research going on all over the world. So continuing to support research in this area is important. Insurance coverage issues. A lot of the therapies aren't covered by insurance, so that makes them costly or out of pocket. Some of the things, if you want to try, I just say, go find a YouTube video, Tai Chi or Qigong or meditation, or get one of the meditation apps. That's one of the challenges or cons. Potential risk, definitely want to talk with your doctor about anything you're thinking of trying, because something may not may interact negatively with your conventional medication or treatment. Time intensive. Lifestyle changes take commitment. Depending on, what therapies you decide on, it can be demanding. So, and then very, practitioner training. So you want to make sure that you ask the questions that you ask, where were you trained, your practitioner, and you know, what have been the outcomes, and talk with your friends, is there anyone they would recommend or use? But I think probably there are more pros to this than cons. And it's a holistic approach. So, it's the physical, the mental, the spiritual health, and aiming for comprehensive healing. Um, it's that personalized care, tailoring it to your individual needs, and promoting that patient self-centered care. Uh, Focusing on prevention, those are those lifestyle changes, to make sure that you have, you're here a long time. What are your goals? What do you want to achieve that, as you age, is it just, being able to pick up your grandkids, or is it, you want to be able to do that hike or do that marathon. And then, reducing side effects. A lot of, if you're on a lot of medications that have side effects, maybe there's a complementary therapy that can help, minimize your reliance on medications or minimize their side effects. So that's an important. And then improving your quality of life, can enhancing your well-being, especially if you have a chronic condition that involves pain, or and working on stress reduction, and just improving your overall health and quality of life. So these are two resources that I recommend for you and your provider, your doctor. The National Center for Complementary and Integrative Health at NIH has a lot of resources, and you can look up different studies, see if different things are effective. I also like the Natural Medicine Database, and that you can put in, certain herb and check it out, and it'll show you some of the research. It'll show you the side effects. It'll show you some of the dosing depending on what it is. So, and you can give that to your doctor too, and they can look up things. So with that, I wish you the very best in your health and your journey, and happy to answer any questions.
Well, thank you, Dr. Siddiqui, for that very informative presentation. We now are going to open the Q&A portion of the webinar. Our first question is from Nan, who asks, what's the difference between pro and prebiotics?
So prebiotics is what feeds your probiotics. So, just like, we need food to develop energy. So the probiotics need some things to feed on as well. So if you think about something in your diet, a common prebiotic in your diet would be like asparagus is a prebiotic. So certain foods and vegetables, I don't have them all at the top of my head right now, but that's the one I can think of the most, is asparagus is a prebiotic. So again, that, like, having that variety of fruits and vegetables will help feed your bacteria, the good bacteria that are in your gut.
Thank you for that, Dr. Siddiqui. Our next question is from Tam, who asks, please cover osteopathy. What is it exactly, and how can it help health?
Can you read that to me again? I didn't hear it clearly.
I'm sorry. Please cover osteopathy. What is it exactly, and how can it help health?
So osteopathic, like, there's a lot of doctors that go to an osteopathic school, and it's sort of follows the same trajectory as a regular medical school. And so actually within Hopkins, we have lots of physicians who are DOs, doctors of osteopathy. And during their training, they also train pretty similar to some of the chiropractic care. So they can do, some, spinal adjustments and things like that. I don't know many that, continue to do that, but yeah, it's similar to chiropractic, but it follows a more traditional, medical doctor route.
Our next question, are you able to speak to requirements for insurance carriers and flex plan use for many of the practices options that you shared?
Um, I can't talk much about insurance, but I do know that like a lot of our staff at our office, they'll use their flexible spending dollars for different therapies and things like that. So I know like flexible spending accounts for healthcare is an option if you have that with your employer.
Our next question from the audience, if this hasn't been addressed yet, could you please discuss how to find a reliable practitioner for specific modalities? And is there a website or other resource for learning more about the evidence for efficacy?
Yeah, so hmm. So there's not like a one-stop shop that I'm aware of for healthcare practitioners. I know if you're looking for a functional medicine doctor, if you go to Institute of Functional Medicine.org, you can find a functional medicine doctor. I'm sure there's similar things for acupuncture. Actually, there's state organizations. So, like in Maryland, there's a acupuncture state organization for acupuncture in Maryland. So, if you went to their website, you would probably find similar, list of practitioners that are in Maryland that you can use for acupuncture. So I think probably when you look at sort of, more state and local organizations, they probably have their listing of practitioners that you could find.
And Dr. Siddiqui, I know you touched on probiotics earlier, but Mary wants to know what is in probiotics and how do they work? And is it putting microbes into the body or something that feeds the good microbes?
So yeah, probiotics are gut bacteria that we need to help support like our immune system and our gut health. And so, we have, billions and billions of gut bacteria that are there normally. And so like if you take a probiotic, and there's mixed things about whether you take, whether the dry ones do anything. You can also buy live probiotics at like natural food stores and things like that. Those usually have to be refrigerated. But most people see an improvement just with the dried products. Either you take a capsule or you mix it in a drink. And yeah, um, so they so they support gut health and they help with how your cells within your gut and within your whole body in terms of making sure you have the right support there for energy support within your cells and making sure your mitochondria have what they need to thrive in the cell.
Okay,
Yeah,
so
it's
the
a,
next
it's a whole
one,
lecture.
I bet. Unfortunately, we don't have time for that today. So our next is actually a comment, not a question. Rosemary wants to comment that tapping is helpful for me. It is sometimes called acupuncture without the needles. It is a form of self-help.
Yeah. I don't know. It's very popular these days, tapping, and so I don't know the science behind it, but I've heard good things about it. So yeah, definitely, that's great. That's helping you.
Our next question is, how does therapeutic touch differ from massage?
Um, you know, sometimes therapeutic touch, you know, doesn't always have to be, therapeutic touch can be a hug, therapeutic touch can be, not when we think of massage, we usually think of something that's a little bit deeper, but sometimes therapeutic touch is just, like holding someone's hand, rubbing someone's arm, giving them a hug, and, sometimes just being there. Um, when we talked about Reiki earlier, Reiki is more of an energy thing. You're not necessarily touching the person, but you're just sort of, ch channeling energy, through their body. But
And someone in the audience is curious about CBD. What would you recommend or what would you offer to the audience, Dr. Siddiqui, on CPD?
CBD,
CBD, I'm sorry.
um, uh, there's a lot of controversy. There's a lot of, research out there. It definitely can be helpful for certain conditions. Um, you know, uh, I can't really, I haven't used it for patients, although some of my patients have, like my teenagers have used it, when they've gotten older for certain conditions and they've just basically got it from the outside. And I support them the best I can. So I'm not an expert in CBD, and I'd probably refer you to, someone else in the community.
Our next question is, or actually it's a comment and then a question. I have found that allopathic providers often don't know about the benefits of integrative practices, so don't always know how to guide their patients to these interventions. Do you have any suggestions on how patients can approach how to talk to the provider about interest and get informed guidance?
Yeah, you brought up a really good point, and that's one of the reasons why, we're trying to, support our, you know, talk to our medical students, early on so that, they know, how to look at things. And I think, one of the most important things I think that you can do is just be honest with your provider. And sometimes you have to go out and do the research yourself and bring it back to them because they're busy. They don't have time to always, look at things, and also, give them the resources, like, show them the resources that I showed you, like with NIH or with, with the natural medicine database. So, you know, they can pull it up on their computer right then and say, oh, hey, well, maybe this is a good thing that can be used. And, and just, you know, that importance of, your relationship with the practitioner, is important in terms of, and maybe, at least like you can say, well, maybe if there's no research saying that, it's neither good nor bad, at least doing like maybe a trial of something to see if it has any benefit for you.
Yvette wants to know, are there any recommended therapies for alcoholism?
Uh, yeah, there are. I I know that acupuncture can help with that. Um, that's off the top of my head, but there are, and Tony, I don't know if you get people's information, but I could get back with her on more specifics. So
Okay,
can email
sure,
you and then get back to me or something. So
sure, sounds good. Will the cut in federal funding to NIH have an effect on further research on integrative medicine?
yeah, that's a very good question that a lot of us are concerned about. Um, I think we'll probably know more this fall. But yeah, It definitely could. I mean, there's some, you know, there's some, you know, the research is very concerning, yeah, but there are some, international organizations that really support integrative medicine research. So, I'm hoping that if, funding is cut, then, things will continue at other levels or looking into nonprofits for additional support.
Are there any specific health conditions where integrative medicine is especially beneficial or not recommended?
Oh, um, I think it's beneficial for all conditions. And I can't think of anything where it wouldn't be recommended. I mean, I think we talked about some of the things, especially, you just have to be, safe and careful, especially as you age in terms of, you know, making sure that if it's something physical that you're doing, like some of the movement meditations, I don't think didn't talk about yoga, but like yoga therapy, that's another sort of movement meditation where, uh, you might, someone younger might be more agile than an elderly person in terms of doing yoga as a movement meditation. You always have your breath, and that's a great meditation, even just breathing in and out, and can help like relax you, lower your blood pressure. We talked about some of the herbals that you need to avoid, especially if you're on blood thinners, like the St. John's wort. So again, like doing your research, we've, the internet is great in terms of looking things, but look at those databases and really do your research before you start something and get the right information and talk to people.
Dr. Siddiqui, briefly, could you talk about what role does mental and emotional health play in integrative care?
Um, that, I mean, probably eh, that's part of your whole body, mind, body, spirit sort of thing. So it's very important, and there's so many components to integrative medicine that can help with your mental emotional support, and even just doing small things, like uh, the COPD people that were doing the Tai Chi, then they not only improved, their breathing and things like that, but it made them feel better. So even taking small steps can help you emotionally. If you can't walk around the block, walk down to the driveway and back, and just those gradual steps in terms of any therapy that you try to start or do will help you in your mental capacity. And the meditation definitely can help with your creativity, getting through the day. Before I started meditation, I was like dragging at the end of the day. I had 3 kids. When I started meditating, I had so much energy. I was able to get their lunches done for the next day. So it's not just about, it's about clearing your mind and giving your brain a rest, the meditation, but it can help in so many other ways.
Ladies and gentlemen, this concludes the Q&A session and today's webinar. On behalf of the Community Health Wellness team here at Suburban Hospital, we sincerely thank you for joining us and extend our deepest gratitude to Dr. Siddiqui for sharing her expertise today and answering these thoughtful questions. We hope this discussion helps you make more informed choices regarding your health. As a reminder, please take a few moments to complete the survey that will appear at the end of the webinar. Your feedback is greatly appreciated and helps us improve future programs. Thank you again and have a wonderful rest of your afternoon.